Welcome to this edition of Modern Aesthetics Journal Club. I'm Rebecca Kazin, here today with Dr. Todd Schlesinger, talking about patient satisfaction surveys. Welcome.
Thank you.
So you recently gave a talk on surveys, and I'm very interested to hear how you utilize them in the practice and what different surveys you do.
Why do we use surveys in the office? Well, patient satisfaction is very important. We all work very hard to get good patient satisfaction. So I think it's very important to actually measure to see what your satisfaction is, and for that reason we use a couple of different survey instruments. We send our patients a survey one business day after each one of their appointments. And the reason why we send the survey one business day and it goes by email is because that seems to be associated with the highest response rate. We began using surveys with paper surveys, and we only got 1 or 2 responses every day. And now, when we went to online surveys or email surveys, we get about 100 to 150 surveys each month. And the way we conduct the survey is by email. And we'll send the survey out and we'll say, for example, you're going to answer, we'd like to take a few moments to answer our 8-question survey. And so that sort of tells them they're not going to be, spending too much time on the survey, and it's something they can do kind of quickly. The platform that we use, we think it's very important to pick a HIPAA-compliant platform. We happen to use SurveyMonkey, and there's other ones that are out there, but HIPAA compliance is important. And why is that important? Because if you're going to ask questions on your survey, you might want to have an open comment box. We have an anonymous survey, but there's an open comment box if the patient wants to put some details about their appointment or how their experience was, and it's very helpful. The key thing about making a survey is you want to have a survey that actually asks about each part of your practice. So from check-in to check-out, how was the provider, how was the office, things like that. And that helps you gauge, for example, if there's an issue in the practice going on, you don't know about it, you're going to find out right away from the patient survey. Mm-hmm. So that's why we do it. The single most important question that we want to know from our patients is, would you refer your friends or family to the practice? That's key. We want that number to be as close to 100% as possible. And so that's an important thing about surveys. The other thing that we do is we actually use an internal survey as well. So external surveys when we survey patients, out there, our patients, and internal surveys is where we survey our staff. We want to ask the same kind of questions. Would you recommend our practice to your friends or family? If your staff isn't recommending your practice to your friends or family, then your patients probably aren't going to be either. And so those two things are inexplicably linked together, patient and staff satisfaction.
What's your target response rate?
Our response rate overall probably hovers around 10 to 15% of all the surveys we send out. Most people don't answer them, but like I say, we get about 100 to 150 surveys a month, and that's increasing. And it creates a nice set of data. On average, many dermatologists might see, in their practice, 100 to 150 patients a day. Right. So you're only getting, a small fraction of those people that are responding, but it's very helpful information.
Do you tell the patients when they're checking out that they'll be getting an email with the survey link?
We do. Yeah, we tell them either at the checkout, or we might tell them in the room when we're seeing them. We don't necessarily tell everyone that they're getting, it's not a definite part of the checkout process, but it might be a good idea to add that.
Do you find that you generally get survey responses from people who are either really happy or really not happy?
I think that's a good question, because you have to think about what you're going to do if you get a bad survey. So say you put your survey instrument up and you start measuring, and then, wow, you get a bad one, like somebody was really unhappy. You have to sort of take a step back and don't try to tunnel out that patient or tunnel out that staff member and, what happened here. You take a step back, take a breather, and see if you can use that for learning. We share our surveys with our staff members, so they're able to learn from them, and they know that we're doing it all the time. So it sort of also keeps everyone accountable. Mm-hmm. What are good surveys for? Good surveys are good for validating your current practices, understanding some aspects of the practice that your patients like a lot, and bad surveys are where your greatest opportunity for learning is. And hopefully there's not a lot, but every now and then, you'll get a negative survey, and you can really use that. The other thing that surveys are good for is also it might help keep your patients from going to the internet. If they already know they've had a venue that they can, express a concern about their experience at the office, hopefully you'll prevent them from going on and putting an online review on Facebook or Yelp, which you'll have to then do reputation management to deal with that. So it gives us a chance to intervene as early as possible.
I think that's really interesting. Have you had any feedback from the patients about it?
It's good. I mean, we ask certain questions. I talked about asking about each step of the practice. The patients are generally happy most if you're doing a good job with your office, they're generally happy. Most people don't really comment much on the survey as far as the actual instrument itself. I think people are very used to it now. I mean, every time I take my car to get serviced, they send me a survey. They're all looking for 5-star customer service. And I think if you're going to offer 5-star, you want to offer the 5-star customer service, and you then want to find out, yes, am I really offering that at each, what we call touch point, or each, point that patient interacts with your practice.
For somebody to develop a survey, do you recommend getting help developing the questions?
I think that depends on who you have working on it. It's something you can develop easily yourself. The one thing you're going to understand about is if you're not getting the right answers from your patients, you're probably not asking the right questions. You can always change the questions up each and every time. So you can do it internally. I think it's easy enough that you can do that, but you also can hire a marketing company to help you design the questions.
Reading your surveys back, do you have any thoughts on how physicians can better communicate with their patients?
That's a good question. I really think it's important to communicate well with them, and setting their expectations up front is critical. So as far as, like, say for example, there's going to be a side effect from a procedure, or you're going to have bruising from a filler, or you're going to have a Mohs procedure and that's going to cause bleeding or whatnot. It's important to do your best to set the expectations up front. Try to help the patient as far as if someone calls in or emails in with a question or concern, you want to jump on that right away and make sure they're well taken care of. It's just taking care of people. I think if you take care of people well and your staff take care of them well, if they're satisfied with their work environment, you're taking care of your staff are going to then help you better take care of your patient. I think it's very top down. It comes from the leadership of the practice, and so if you're setting a good example, I think you're going to get better satisfaction results.
I think it's great. I think patient satisfaction is key, and I'm glad that you came to talk to us about these surveys, so thank you.
Thank you for having me.
So thank you for joining us at this edition of Modern Aesthetics Journal Club, and we hope to see you soon.